For people in chronic pain, what we like to do with them is something that's simple but important, and that is to track out their pain so we can see how it's spreading. The muscles in the body work in chains. So a dysfunction here can eventually manifest here, can eventually manifest here, or even here. And sometimes it can happen all together if the problem's been going on long enough. Most of these problems actually start from the way the head sits on the spine. So when people get into this forward head posture, or a poking chin, or just an excessive droop, all these things can actually pull and squeeze a muscle. And if it's, the person's holding a position for long hours doing their work, they can have these issues. So the basic thing is to understand, okay, today it hurt here. Sometimes with a picture of the body, we can actually track it. And later on, start to work and hurt down here. Sometimes if I have a pain that shoots into here, or it shoots up onto the face. All these things help us as doctors understand how serious the problem is and how aggressive we have to be with treatment. And I say this because people come in, they say, I have the most severe pain, I can't sleep, and would think, okay, you had all the physical therapy, you had all the tablets, nothing's getting better, let's work on injections. And they say, no, I'm not that bad. Okay, it's your body. I mean, if you want to do what you want, do what you want, but if you keep suffering, it's no point. Right? But the thing is, as doctors, we don't know your pain. Only you know your pain. So if only you know your pain, and then you don't want the treatments we offer, there's a communication gap. But things like a diary that show, today I had pain here, tomorrow I had pain here again, and I had pain here again. Well, it shows, okay, there's one area that is bothersome. If that pain starts to radiate, or if it's quiet for a few days, that's a different picture. Right? But we don't get that information from people, and by the time they come to us, they're often not feeling good, so they can't even remember how long it's been there. Most people, when you ask them how long have you had pain, they'll say for 2 weeks, but actually they've had it for years, on and off. Some people who had pain for years try to ignore it, or they know how long they've had it, but they don't know what to do. So more information for a doctor can be really helpful, and we can make a treatment plan for you, customized based on this information. But most people can't say it when they come in a clinic because they can't remember it properly, and these diaries do help.